Hi everybody, Janie Goddard here, President of the Complementary Medical Association. I just want to do this very quick video for you because we've just this moment had a letter from one of our insurers, Balen's, and it talks about a coronavirus absolute exclusion for our members in Ireland. So this only affects you if you are working in the Republic of Ireland. So I just wanted to just read the letter to you so that you know exactly what it's about. There's also a really helpful sort of explanation from Balen's themselves. So let's get straight to it so you know exactly what's going on. Obviously Balen's state that they understand this exclusion is in line with the stance already taken by many other providers in the market. So it's not just Balen's or AXA who are their underwriters. And this is now mandatory for all AXA policy holders. We appreciate that this is likely to raise a number of concerns for both you as an association. Obviously that's us, the Complementary Medical Association, and of course it does, because we need to know exactly what's going on and bring you the most up-to-date information possible. So let's just read you, just what they've actually said further. They're saying, of course, that the coronavirus pandemic is currently at the forefront of everyone's minds and will continue to be a concern for people as they adapt to returning to work. Of course, we know all that, don't we? Although we appreciate and mirror these concerns, we do feel the introduction of this exclusion in practice will have a minimal impact on our policyholders and their businesses. So although we acknowledge a small risk remains, this is obviously coming from Balen's themselves. So they're also saying, in practice, for a valid claim to be raised against a practitioner or business in relation to COVID-19, any would-be claimant would need to prove that the practitioner breached their professional duty of care and that this related or resulted in a situation for which they could be held legally liable. In this scenario, the claimant would need to prove the practitioner or business were directly responsible for the injury or loss. In addition to the above, the practitioner can further mitigate any liability by demonstrating that they have followed government guidelines and where applicable, the guidance of their professional association in relation to risk management, and that these measures adopted are noted. By doing so, any potential risks should be minimized and any required defense can be better made. So that goes back to everything that we've been saying throughout the very start of lockdown and so on. As long as you are able to show a paper trail and to demonstrate that you are absolutely compliant with government legislation in your area, you should be absolutely fine. As Balen's point out, the onus would be on any claimant proving that you infected them or that your place of business infected them, should the worst happen. Of course, obviously we hope that that doesn't ever happen, but should the worst happen. But what they're saying is that your position with the insurers would be so much stronger if you are able to make sure that you can demonstrate, as we've been saying to you throughout, demonstrate by keeping paper trails of exactly what you're telling your patients before they come to see you, of exactly what steps you're taking to sanitize and clean your environment, what you're doing as far as PPE is concerned, donning and doffing correctly, and all of that. As you know, we've got all of that information for you on the CMA website, so please don't hesitate. Do go over there. We'll make sure that you have the link to this in the bottom of this video. And we'll be putting this video all over the place, so we'll put it on YouTube. We'll also put it onto Facebook as well, and also have a link to it in the newsletter so that we can just make sure nobody misses it. So anyway, so that's the crux of the matter. The actual text regarding the coronavirus absolute exclusion reads as follows. So you've got this for your notes. I know that Balen's will be writing to you with this as well, but just in case. It says, not with understanding any other provision, no cover is provided under this policy for any claims, loss, liability, cost or expense of whatever nature, directly or indirectly arising out of, contributed to or by resulting from coronavirus disease COVID-19, severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, or any mutation or variation thereof. This exclusion also applies to any claim, loss, costs or expense of whatever nature, directly or indirectly arising out of, contributed to or resulting from the following. Number one, any fear or threat, whether actual or perceived, of or to any action taken in controlling, preventing, suppressing, or in any way relating to any outbreak of coronavirus COVID-19, severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2, or any mutation or variation thereof, subject otherwise to the policy terms, conditions, limitations, and exclusions. All other terms and conditions remain unaltered. So Balen's then go on to say, we're in the process of writing to all members to explain the new exclusion and the effect it may have on their policy. We're also highlighting the inclusion of this in our new business packs, so all policyholders are aware prior to taking out cover. Quite honestly, it's very much what we've been saying to you all along, as I just said. So just please make sure that you are safeguarding yourselves by ensuring that you've got your paper trail, whether you're in the Republic of Ireland or Northern Ireland or any of other of the UK countries or elsewhere overseas as well. Making sure you've got that paper trail will keep you safe as far as your insurers are concerned. So please do make sure that that's all in place and that you're following the letter of the law as best you possibly can, and just make sure that you're sticking to all of that. Thank you so much. All the best. Bye-bye.